Thank you for inviting me to give this talk. For the next 25 minutes, I'm going to talk to you about the psychological burden of food hypersensitivity. Why is food hypersensitivity a burden? Well, first of all, let's think about what food hypersensitivity includes. It includes not just food allergy, but also things like food intolerance, which involve an unpleasant reaction to food that doesn't involve the immune system, and also celiac disease. And each of these result in unpleasant foods if a food is eaten that causes a reaction. And it's really a burden because generally the individual's well as long as they avoid that food and they're in good health, but they're at continual risk of symptoms after eating, and we can't avoid eating. And we have to make these risk assessments each time we eat to check that what we're going to eat is safe for us. So this creates a lot of fear and worry because for some of these hypersensitivities, a reaction can be very severe, it can be life-threatening, and at the very least, it's extremely unpleasant. So management of food hypersensitivity requires constant vigilance to avoid an accidental reaction. Now, although there's a lot of fear and stress and anxiety, particularly around the seriousness of a reaction, fatalities from food hypersensitivity are fairly rare. Some research suggests that only around 1 in 800,000 deaths per year are due to food allergy. But of course, we see lots of media reports of particularly food allergy related deaths, particularly peanut allergy related deaths. And so for people who this affects, this can make the risk feel much greater, and this can cause a lot of stress and anxiety and has an impact on quality of life. We have quite a lot of research evidence looking at this now, although it is a fairly new field of research. Only maybe in 2000 was the first papers starting to be published on how food allergy at that point has an impact on quality of life. But over the last 20 or so years, the research has demonstrated a consistent finding that food hypersensitivity, including allergy and intolerance and celiac disease, has a detrimental impact on the lives of patients and their families. A lot of the research, to start off with, was focused very much on quality of life, and I'm going to talk about a couple of examples of that in a moment. But more recent research has focused on other types of impact, particularly around mental health. So looking at things like depression and anxiety, stress, and very recently, some research looking at post-traumatic stress symptoms, showing that parents in particular of children with food allergy show symptoms of post-traumatic stress. So let's just have a look at a couple of recent examples. This is a paper we published a couple of years ago now, looking at the productivity and psychosocial impact of caring for a child with peanut allergy. This was a UK-based study called the Paprika study, and we measured health-related quality of life in caregivers of children with peanut allergy, and we also asked the caregivers to report on the quality of life of their children. And they also, we asked them to report the severity of the peanut allergy. So this was self-reported severity, either mild, moderate, or severe. All of the caregivers who reported on their children said that peanut allergy had a significant impact on their lives. And in particular for the parents, it impacted on their careers as well as their quality of life. So it impacted on their productivity. And what we found interestingly in this study is that male and female caregivers suffered that same level of impact on their careers. This is something we haven't found before. A few years ago, we conducted a similar study looking at mums and dads of children with peanut allergy, and it seemed to be the mums who reported the greater burden. Well, this particular study here, we were very fortunate in having a large number of males, a large number of dads complete the survey as well as the mums, and finding that patterns seem to have changed over the years. And now dads are also reporting a high level of negativity or negative impact on their career and productivity, but also quality of life and also mental health. So when we asked them to report about the severity of the peanut allergy for their child and how this might have an impact on their children's quality of life and on the parents' own mental health, we found that severity indeed was a really good predictor. So parental reported severity of peanut allergy was significantly related to level of burden. This was particularly so for the older children, so those aged 11 to 15 years in this particular study. We looked at predictors and we found that 2 or more reactions in the past 12 months to peanut and the level of parent anxiety was significant predictors for the levels of burden for the child. So these are really important things for us to understand and things that we can perhaps think about targeting when we want to reduce the burden of allergy. So we want to look at things like parental anxiety. How can we manage or help parents manage their anxiety? And how can we help them manage having accidental reactions? I mentioned mental health, and we measured anxiety in this particular study of the caregivers. And we looked at anxiety in relation to a number of things. We looked at anxiety in relation to severity of the peanut allergy, but also anxiety in relation to what a UK healthy population would report in terms of anxiety. And on this graph, if you look particularly at on the right-hand side, if you look at the red, the bars that are coloured in red, you can see at the top that when we looked at severity of peanut allergy, then parents reporting both severe and moderate peanut allergy in their children were reporting much higher levels of anxiety. The red is referring to moderate and severe anxiety levels. Many more parents are reporting moderate and severe anxiety when their child has what they believe is severe or moderate peanut allergy compared to mild. And then we looked at males and females levels of anxiety in relation to UK norms. So what a normal population, a healthy population without any child with a long-term condition, what they would report in terms of anxiety. And again, you can see, particularly if you look at the red, that our females and males in this sample, many more of them are reporting moderate to severe anxiety compared to a UK normal population. In this study, we also measured general quality of life. So rather than looking at just at peanut allergy specific quality of life, we also looked at general quality of life using the EQ5D. This is a really widely used measure to look at quality of life across a range of populations and a range of conditions, but it's not been used much in the field of allergy. And what's useful about this particular scale, this general quality of life scale, is again, it comes with population norms for the UK. And again, so we looked at general quality of life in the children as reported by the caregiver. And we looked at it in relation to severity of the peanut allergy and also in relation to these UK norms. And again, here you can see that particularly for severe peanut allergy, where parents are reporting they think their child has severe peanut allergy, their general quality of life is much lower than the UK norm population for young adults. So in that particular study, we were looking at peanut allergy, and a lot of the research does focus on allergy in particular. There's very little research exploring the impact of quality of life across different types of food and different food hypersensitivities. There is a suggestion that some foods that are hard to avoid, that are used in lots of ingredients or in a wide range of foods, have the biggest impact. So a study we published a few years ago now, we looked at the differences in quality of life in parents of children reporting egg allergy compared to peanut allergy, and finding that egg allergy seemed to have a bigger impact on quality of life than peanut allergy. But there's very little research looking at this in terms of the different foods being reported and almost no research comparing across the different food hypersensitivities. So this brings me on to our food sensitive study. The food sensitive study was funded by the Food Standards Agency. And what we wanted to look at was the management of food hypersensitivity of individuals living in the UK and evaluate the impact on their quality of life. As I've just mentioned, there's very little data on the impact of the different food hypersensitivities, so we wanted to look at that. In particular, there's not much research on the impact of food intolerance. And no studies that I've come across that look at the differences across the food hypersensitivity types. So studies don't seem to really look at differences in the impact of an allergy compared to an intolerance compared to a celiac disease in one sample. And very few studies also focus on adults. So we have a lot of focus on children and adolescents and also on parents, but very fewer studies to looking at adults. The food sensitive study includes 2 work streams. Work stream 1 is the one I'm going to be talking to you about, and this included an online survey to assess the impact of food hypersensitivity on daily lives and quality of life. And we distributed this in 2 waves, 1 year apart. So I'm going to tell you about the results from the first wave that we ran just over a year ago. But there is another work stream, and this was looking at what we call willingness to pay values. So basically in work stream 2, they were looking at how much someone will be willing to pay to remove the anxiety and the day-to-day impact related to having a food hypersensitivity. Workstream 1 then was run between, this first wave of this online survey was run between October 2020 and January 2021. And we collected data on the impact of food hypersensitivity on adults, on children aged 8 to 17 years. So they reported themselves. And then we asked parents to report on their children with a food hypersensitivity. So any parent with a child aged between 0 and 17 years. We collected a huge amount of information. So our participants were excellent in spending a lot of time filling in a lot of measures for it. We asked for a lot of demographic information and also food hypersensitivity information. So things like the foods and the symptoms they reacted to, but also things like how it was diagnosed, if they'd been to hospital, what their medications they've been provided, reactions that they'd had. So it was quite in-depth information on their food hypersensitivity. And we also asked about eating out, shopping, food labeling, and managing food hypersensitivity in social situations. Now, food hypersensitivity is a very complex area because people can react to a number of different foods, and they can also have an allergy to one food or an intolerance to another food. So we had to work out what was the best way of getting lots of information without overburdening our participants. So we asked them to report on all the foods they reacted to, just in one table, but then we asked them to give us detailed information on up to 3 foods. And for parents, we asked them to provide detailed information on up to 3 children and 3 foods per child. So the databases were absolutely huge, and we had thousands of foods being reported. But we also asked participants to tell us if they thought that they were reacting because of an allergy, an intolerance, or whether it was celiac disease. And this was linked then to the specific quality of life scale they were asked to complete. So we used validated measures to look at food allergy, quality of life, food intolerance, quality of life, celiac disease, quality of life. As you can see those at the bottom, the FAQLQs and FIQLQs, and then the celiac disease, the CD, quality of life. And then we also use that generic measure that I mentioned before, the EQ5D. This is the numbers that we had in our participant group, and you can see we had well over 1,000 adults respond for us. We had nearly 800 parents of children, and we had 267 children as well. So a huge participant group to analyse. And these, they were reporting allergy, intolerance, and celiac, but some of them were reporting those multiple hypersensitivities, whether they were reporting mostly allergy and intolerance, and some reporting that they just weren't sure, that they reacted to a food, but they weren't sure what that reaction was. There is a huge amount of data from this study. So I have just picked out some of the key things for you, things that I thought would be interesting. And this was mainly around eating out, reading food labels, and the quality of life. Most respondents then checked that information about foods that cause a reaction at various points when eating out, that they checked this either always or most of the time. So this is really encouraging. People are checking information. They're not just blindly eating things and which could increase their chances of having a reaction. The graph here is for adults, but it is very similar for parents and for children. And you can see that always or most of the time, people are checking information before deciding where to eat out, before ordering food, and they're asking staff when they're ordering. We also looked for checking information across the different types of food hypersensitivity. Were there any differences here? And here, parents of children with food allergy or with celiac disease checked information was available more often than the other groups. So those with food intolerance or those with multiple hypersensitivities weren't checking that information quite as often as those with allergy and those with celiac disease. We also looked at our results by age. So are there differences across adults, parents, children? And so here is just an example looking at checking information by children. And again, really encouraging that lots of children telling us that they are checking information themselves. You can see here that checking information before deciding where to eat out, before ordering and asking staff, almost half of the children doing this themselves. But we can also see that about a third are also relying on parents to do this. And of course, we've got children here from the ages of 8 up to 17, and it was the younger age groups that were mostly reporting that they were relying on parents for this. We asked adults, parents, and children how confident they were asking for this information and how comfortable they were doing so. So although they are checking information and they're asking for information quite a lot, most of the respondents said they did feel quite comfortable doing this. They felt comfortable asking staff for information when eating out, and they were pretty confident with written information provided, but they were much less confident in verbal information provided by staff, and especially those with food allergies were reporting that they were much less confident when asking staff in a restaurant about allergens in their food. They were less confident with the verbal information provided. In this graph here, we've just got an example again from adults, but the pattern is very similar for parents about how confident adults felt when they asked for that verbal information. For children, actually, they reported being a little bit more confident with that verbal information than the adults and the parents did. Moving on to shopping then and reading food labels, again, very encouragingly, most of the respondents telling us that they checked labels always or most of the time for ingredients that would cause a reaction, but they were less confident in information provided by food markets or stores or in food sold loose. And this was in comparison to things like supermarkets or independent shops. So you can see here, this is an example from adults. If you look at the percentages in the dark green, how many of our adults were very or fairly confident in information, we can see that most of them are reporting being very or fairly confident for in-store supermarkets. But then if we look on the far right-hand side for food markets, only 24% are reporting that they are very or fairly confident with the information from those sources. So how does all this affect quality of life? This is what we've been looking at. It's really interesting gathering this data, but we want to know about how all of this might have an impact on people's quality of life. All of the respondents in all of our groups reported that quality of life was impaired quite a bit or very much. So all of them were reporting over the mean levels for these allergy, intolerance, or celiac disease specific quality of life scales. And adults in particular with food allergy or multiple food hypersensitivities were reporting the highest impact on their quality of life. Again, you can see here in the graph, this is just an example from adults, and this is adults with food allergy or multiple hypersensitivities. And on a 0 to 7 scale, with 7 being the greatest impact, you can see they're all scoring fairly highly on this particular quality of life measure. We looked at quality of life in relation to a number of clinical things, a number of clinical variables, and self-reported severity seemed to come out as significantly related to impact on quality of life across all groups and all food hypersensitivities. So greater self-reported severity was related to a bigger impact. We also found that a clinical diagnosis rather than a self-diagnosis was also related to poorer quality of life. We did ask all of our participants how their food reactions were diagnosed, and then we looked at the type of diagnosis, the clinical diagnosis, compared to those who hadn't been to a clinic at all and were just self-diagnosing. And so quality of life seems to be a bigger impact if they have received a clinical diagnosis. What makes quality of life better then, and what makes it worse? This is really what we're interested in order to be able to think about interventions, to think about changes in policy. How can we help our families manage? Well, if they can eat out more often, if they're more comfortable asking staff for information, if they're confident in the information that they're provided, and if they report a much milder severity for their food hypersensitivity, they report much better quality of life. However, the frequency of having to check all of that information has a big impact. So checking information at all the different stages of eating out, the frequency of checking food labels, and a greater self-reported severity all predicted a poorer quality of life. And this was pretty much across all of our participants, all of the different ages and the different food hypersensitivities. When we looked at generic quality of life, we found some really interesting findings. If we look at adults, then the scores for things like mobility or usual activities were better in our adults with food hypersensitivity than the UK norms. But when we looked at scores for things like pain and discomfort or anxiety and depression, they were much worse than the UK norms. For this generic quality of life measure, we don't have norms for young children, but we did just look at differences across the different subscales. And again, mobility or usual activity scores were higher for children with food hypersensitivity compared to the scores for things like pain and anxiety. And food intolerance and those with multiple food hypersensitivities reported poorer quality of life than those with allergy or celiac disease. And this is a very novel finding because a lot of, we just don't have this data. We don't have studies that look at differences across intolerance, allergy and celiac disease until the food sensitive study. And for some reason, those with food intolerance are reporting poorer quality of life. And this is something we need to be investigating further. So in conclusion then, the food sensitive studies provided a fabulous insight into the impact of food hypersensitivity on the daily lives of people in the UK. Eating out and food shopping activities all seem to be related to quality of life in consumers with all types of food hypersensitivity. However, the frequency with which they have to check can create this greater burden on our consumers. So being able to eat out and confidence in the information provided without a higher burden of checking information should be supported for those with food hypersensitivity. And I just want to finish with what our next steps are. I did say we had wave 2. Wave 2 is now complete, and we've got an even bigger data set, which is fabulous. Participants for wave 2, we had over 1,000 adults, 750 parents, and nearly 350 children. And we added some questions, including reactions in the last 12 months and where these occurred. And there's some very interesting findings coming out of that. And we've been able to compare wave 1 and wave 2. And we're going to be disseminating these results at the joint World Allergy Organisation and British Society for Allergy and Clinical Immunology Conference in Edinburgh in April. So I'm really excited to be able to do that. So thank you very much for listening.